The kidneys is an essential component of the body's filtering mechanism. The kidneys filter waste, poisons, and excess fluid from the blood through urine. They also contribute to the production of red blood cells and release hormones that maintain stable blood pressure. They even produce a bone-healthy type of vitamin D. You might not be aware that some medications may be harming your kidneys and other body components if you don't know how well your kidneys are functioning. The kidneys filter both prescription and over-the-counter drugs. This indicates that your kidneys break down and eliminate drugs from your body. However, your kidneys cannot remove waste as they should if they are hurt or damaged. This kind of damage can be brought on by a number of drugs and medical conditions, including diabetes and high blood pressure. Medications that are harmful to the kidneys are called nephrotoxic medications. Nephrotoxic medicines are known to be detrimental to the kidneys. While some of these drugs may cause more significant harm, others merely marginally impair kidney function. Your unique medical conditions and the prescription or medications you take will determine your risk of kidney impairment. Number 1. NSAIDs. Non-steroidal anti-inflammatory medicines are common treatments for fever and pain. Additionally, they are frequently used to treat a variety of illnesses, including inflammation, menstruation pain, and rheumatoid arthritis. Some common NSAIDs are ibuprofen, naproxen, aspirin, meloxicam, and diclofenac. Even while NSAIDs like ibuprofen are usually well accepted, there are hazards associated with using them. Kidney injury or failure may result from these drugs' ability to decrease blood flow via the kidneys. NSAIDs increase the chance of developing new kidney problems or making pre-existing kidney problems worse in people with heart failure, liver disease, or kidney disease. NSAIDs reduce the synthesis of prostaglandins by blocking the cyclooxygenase (COX) enzyme. Because prostaglandins keep blood flowing to the kidneys, lowering their levels can result in less renal perfusion, particularly in patients who already have health issues. Prolonged use can lead to acute kidney injury, AKI, chronic kidney disease, CKD, and nephrotic syndrome. NSAIDs should generally be used sparingly for the shortest amount of time and at the lowest effective dosage. Kidney damage is significantly less likely to occur when NSAIDs are taken in acceptable dosages on occasion. Number 2. ACE inhibitors. The preferred drugs for treating heart failure and high blood pressure are ACE inhibitors. Additionally, they can shield the kidneys in certain circumstances. However, because ACE inhibitors are eliminated from the body by the kidneys, there is a chance that they could harm the kidneys. If you're dehydrated or using other nephrotoxic medications like NSAIDs and diuretic, you're more likely to have kidney issues linked to an ACE inhibitor. All ACE inhibitors and ARBs offer kidney protection, along with additional advantages, such as lowering blood pressure, delaying the glomerulus, the kidney's tiny filters, deterioration in kidney disease, delaying the heart muscle's deterioration in heart failure, and reducing the risk of heart attack or stroke, particularly in those who have already experienced one. Number 3. Antibiotics. The kidneys are responsible for the clearance of numerous antiviral, antifungal, and antibiotic drugs. Several antibiotics are nephrotoxic because of their impact on renal tubular cells or their capacity to directly harm the kidney. Some antibiotics, such as vancomycin and aminoglycosides, gentamicin, tobramycin, can be toxic to the kidneys, especially when used for an extended period of time or in people who already have renal disease. Compared to persons with healthy kidneys, those with renal disease require less antibiotics. Vancomycin-induced kidney damage typically occurs 17 days after the start of treatment. Additionally, if therapy is discontinued, renal function typically recovers. The hospital's pharmacists and prescribers collaborate to closely monitor you and your vancomycin dosage each time it is given. Urine crystals caused by some antibiotics can impede urine flow and harm kidney tissue. Some people can develop an allergic reaction to antibiotics that manifests as inflammation in the kidneys, known as acute interstitial nephritis. Use the lowest effective dose, monitor renal function regularly, and consider alternatives in at-risk populations. Number 4. Cancer treatment medicines. Chemotherapy is a medication used to destroy rapidly proliferating cells in the body. Depending on the kind and stage of the cancer being treated, chemotherapy can be administered topically, orally, by injection, infusion, or infusion. Since cancer cells grow and proliferate far more quickly than the majority of body cells, chemotherapy is most frequently employed to treat cancer. Some chemotherapy drugs that are known to be nephrotoxic include cisplatin, carboplatin, ifosfamide, and methotrexate. The following are some variables that may influence a patient's risk of developing kidney damage as a result of chemotherapy. The chemotherapy medication's dosage. Some cancer needs higher dosage of medication to see the effects. Additional medications, whether additional medications are being taken concurrently. If the patient already has renal disease, this is known as pre-existing kidney disease. To help prevent kidney damage, doctors may increase the number of fluids in chemotherapy infusions, prescribe protective medications, perform tests to monitor kidney health before and during chemotherapy. The doctor might look at other cancer drugs that have a lower risk of kidney damage, depending on the circumstances. Number 5. Contrast dye. Diagnostic procedures like MRIs, CT scans, and angiograms are frequently performed because they can aid in diagnosis and therapy and offer valuable information about a variety of illnesses or injuries. To improve these tests, a contrast dye is frequently required. Changes in renal hemodynamics and direct toxicity to renal tubular cells are the causes of contrast-induced nephropathy, CIN. However, those who have diabetes, a history of blood and heart conditions, or chronic kidney disease, CKD, may be at higher risk for CIN. Over 48 to 72 hours, contrast-induced nephropathy is linked to a precipitous decline in renal function. The symptoms may resemble those of kidney illness, such as increased fatigue, decreased appetite, ankle and foot swelling, eye puffiness, or dry, itchy skin. People can recover from CIN in a lot of circumstances. One is getting enough water through IV fluids, which frequently include regular saline, to aid in the kidney's removal of the contrast agent. With most cases resolving spontaneously over time as the kidneys naturally flush out the contrast dye. Number 6. Diuretics. Diuretics or water pills treat health conditions such as high blood pressure and heart failure. Popular diuretics include hydrochlorothiazide and furosemide Lasix. Dehydration brought on by diuretics may be harmful to the kidneys. Diuretics reduce blood volume, which can cause acute renal damage by interfering with the kidney's filtration function. Dehydration and electrolyte abnormalities may result from diuretics' promotion of the kidney's excretion of water and sodium. Kidney damage is more likely with higher doses of diuretics. Monitor fluid status, electrolytes, and kidney function, especially in patients taking high doses or with underlying kidney disease. The following are some typical diuretic adverse effects: urinating more frequently, lightheaded, and headache. Low potassium can result in cramping in the muscles or weakness. Number 7. Type 2. Diabetes medications. Uncontrolled diabetes is not healthy for your kidneys, but your diabetic meds are. When there's too much sugar in the blood, the kidneys will slowly get damaged as they try to filter out the excess sugar. Although GLP-1s such as dulaglutide, liraglutide, and semaglutide can protect the kidneys, side effects of these medications can include GI symptoms that can cause dehydration and lead to acute kidney injuries. Because it can lead to concerns including swelling, high blood pressure, heart issues, and more, fluid retention can be dangerous. The kidney's ability to eliminate extra fluid is compromised in people with chronic renal disease, so it's critical to identify drugs that may cause fluid retention. Metformin. For the majority of diabetics with chronic renal disease, this oral medication is generally safe. However, in patients with significantly reduced renal function, it may raise the risk of lactic acidosis. Number 8. Proton pump inhibitors, PPIs. By upsetting the delicate balance of electrolytes, especially magnesium, within the kidney, which is essential for healthy kidney function. PPIs can cause hypomagnesemia or low magnesium levels, which can affect kidney function by interfering with the gut's ability to absorb magnesium. PPIs have the potential to damage kidneys and cause acute interstitial nephritis. An inflammation of the kidney tissue known as acute interstitial nephritis can lead to decreased kidney function and, with continued use, result to chronic kidney disease CKD. Although acute renal injury has been documented to develop within hours of pantoprazole treatment, the average exposure time before acute kidney injury occurs is 3 months. The majority of people believe that taking PPIs is safe and beneficial. Actually, some experts are more cautious, while others think the hazards of PPIs are negligible. However, experts advise starting with lifestyle changes alone because many people may effectively treat heartburn with them. If your doctor has prescribed a PPI or an antacid, make sure you take them as directed and don't take them for longer than is advised. Number 9. Laxatives. The main reason laxatives might damage the kidneys is that overuse can result in serious electrolyte imbalances, especially low potassium levels, hypokalemia, significant loss of electrolytes like sodium and chloride. This leads to dehydration from excessive fluid loss, further stressing the kidneys. This, if left untreated, can impair kidney function and possibly result in chronic renal disease. Abuse of laxatives can cause severe potassium depletion, which can result in hypokalemic nephropathy, a condition in which low potassium levels damage the kidney tubules and impede the ability to concentrate urine. Laxatives are generally safe when taken occasionally as prescribed by a healthcare provider. Number 10. Illegal drugs. There are several ways that heroin, an illegal narcotic that can be smoked, snorted, or injected, might harm the kidneys. Coma caused by heroin overdose can result in rhabdomyolysis, a disorder characterized by the breakdown of muscular tissue and the release of proteins into the blood. Myoglobin is one of these proteins, and it can lead to blockage and kidney injury. Dehydration, acidosis, low blood pressure, and oxygen deficit can all exacerbate these symptoms. Intravenous heroin users are more prone to develop bacterial and fungal infections, which can cause severe kidney inflammation. Heroin addicts who inject under the skin are more likely to develop secondary amyloidosis, protein buildup in organs and tissues, or formation of crystals that obstruct the kidney tubules that caused by persistent infections and inflammation that are frequent in this group of people. If heroin abuse is not stopped, it can lead to renal failure. The information provided on this channel is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any decisions related to your health.